mention that because we are saying the same thing.
Okay.
So if you hear blood sugar or blood glucose, we are saying the same thing.
Okay.
But we are saying that sugar
yes.
or glucose that we measure in the blood
yes.
is actually from the food we eat,
okay.
especially the carbohydrate,
yes.
which is also called starch.
Yes.
And when the carbohydrate is ingested,
yes.
the intestine does its own work, which is to digest the food, the raw food or the cooked food that we eat.
Yes.
When the carbohydrate is digested,
yes.
it becomes sugar.
Okay.
And sugar, because it is so useful to the body.
Okay.
In fact, sugar is the best form of energy for the body to produce energy. It's the best fuel to produce energy.
Okay.
So because of that, once there is sugar in the intestine, it simply works. We can look at it. It works easily into the bloodstream, and then it is carried into the heart, and the heart pumps it around. But because it is useful, the body system also guards it.
Okay.
It does not leave the bloodstream unless via some special system. Mm-hmm. So the body has an organ that is called pancreas. It's sitting below the stomach. Mm-hmm. Its own function is to measure the level of blood sugar, how high is the sugar in the blood. Mm-hmm. And it will, depending on the level of the sugar in the blood, it pours an amount of a special liquid that is called insulin. Okay. Insulin is like the key that can now add on to the sugar in the blood and lead it out to the cells. Okay. Because if sugar is in the bloodstream, it is just flowing in the bloodstream. Okay. It's like water in the pipe. Yes. Unless you now open the tap, there will be no water. So in order for water to come out, in order for the sugar to come out of the bloodstream, yes, a person requires adequate amount of insulin to lead it out. Yes. So if the system that produces insulin is faulty, it means you are eating, the digestion is taking place, sugar is in the blood, but it cannot come out. So when we measure it, we find that it is higher than what we expect it to be. Okay. It's not being used for the energy that is meant to be. So that is what we now call diabetes, that when we check your blood sugar level, it is higher than what we expect.
Yeah,
and
but
I've been saying
if that pancreas is working fine, why should it be a problem if I take sugar because I have a sweet
tooth? If your pancreas is working fine, then you are not likely to have diabetes unless you are predisposed.
What do you mean predisposed?
Again, individual, like we started, individuals have tendencies. And we are saying, like some other diseases, diabetes runs in the family. Okay. So anyone that has any member of his family, yes, blood relations that have diabetes, is also likely, he has a tendency, that's a predisposition to becoming diabetic. We are saying your pancreas is at a higher risk. And once the pancreas is not functioning well, and you are eating sugar like any other person eating sugar, the blood level of glucose will just be rising. And since the insulin is not there, or is not enough to bring it out, it will just be. So when you measure what we call a fasting blood sugar, it will be higher than what is normal. Okay. I will mention how do we make the diagnosis. Okay, so that is where food intake or the amount of sugar you eat influences whether or not you will get diabetes. There's another aspect, yes, to diabetes. Your pancreas might be working fine, producing the adequate amount of insulin depending on how much sugar is flowing to the pancreas. Yeah. But where the insulin will work is being blocked. Okay. We call that one insulin resistance. Okay. The amount of insulin that the pancreas should produce is being produced. Sometimes it may even be higher. That means we have two types. We have two legs of what leads to diabetes. Okay. So either there is no production of insulin at all, and that's the one we call type 1. That means the pancreas is not able to produce insulin completely, at almost zero. Whereas there are some that the insulin, the pancreas is reacting well to the blood level, is producing enough insulin, but the insulin has no place to act. So we call those one insulin resistant. That is the commonest type we have as diabetes, people suffering with diabetes. That's the commonest type. We call it type 2. That tends to be more in adults.
Okay. Before I continue, I want to remind us and probably say sorry that most of our calls we were not able to adequately communicate last week. I think the issue has been fixed. You can still call our numbers 090 77 111 5342. Please, we think the issue has been fixed, and so you can call us so that the thing that is being explained, you can get it very well, and we can also hear your perspectives. Before we continue, I would like Dr. Elusoji to tell us what is the burden of disease of diabetes. I mean, what burdens does it lay on us as a society, as a people, as an individual, as a family, and as a health system?
Okay, thank you, sir. Now, in the world at large, it was estimated by World Health Organization that about 422 million people had diabetes mellitus. And that is about, when we estimate the world population at that time, is about 5.68% of the entire world population had diabetes. Okay. Now, it's said to be one of the leading causes of death, the 9th leading cause of death in the world in 2020, as done by a study. So that's to show it's really, really a very large cause for concern, especially in the world. Then in Nigeria, about 5.682, still the similar, they were saying estimated about 6 million.
5.68?
Yes.
Of 200 million?
Yes.
That would give me like 12 million or thereabout.
Yes, percent of Nigerians have. Yeah. And then even in the world, they said about 1.5 million deaths was attributed to diabetes mellitus. So that's to show that it has a Annually?
Yeah, 1.5 million.
Yes. Now, and in Nigeria, they're also saying about 2/3 of the cases of diabetes are not even diagnosed. So that means you have people that have the disease and may eventually die or be misdiagnosed as something else or don't even know, and they are walking around with the disease. Now, the burden of the disease is commoner in majority of it is commoner in low and middle income countries of the world. So it's a very burdensome and,
low and middle income countries.
Yes, so.
And Nigeria is part of that. Okay.
Yes, sir.
Okay. Just continue.
Okay. So that's what the statistics look like in the world. It is a cause for concern, and we know that even if we have a proper, statistics done at this time, it will be higher than what we are getting currently. So it's really burdensome.
So how does it affect the family? What's the burden on the family?
Well, when one person has diabetes in the family, it's going to change the way the family will do certain things. The food that is going to be eaten by the family is going to be changed. We are going to try to accommodate the diet of the diabetic person, because one of the ways to manage diabetes is in diet. Yeah. So the food that the whole family is going to be eating is going to be changed because of that one person. Now, also the output, the person's working or doing certain work, maybe if they were depending on the kind of occupation the person had. If the person is ill and not able to perform at the maximum capacity that they were performing, that's going to be also a problem, because especially if the person is the breadwinner of the family. So that's another issue that we're going to see from that. So these are some of the issues that we would get if someone is diabetic in a family. And also the cost of, taking care of that person.
Okay, do we also have any burden on our health system?
Yes, because if you have, there was an article I read that said the people that are trained to take care of diabetic patients in Nigeria are not as much as they should be. So you have majorly physicians trying to care for them.
Okay.
Yeah. So if that happens, it means we have less doctors that are trained to handle such cases available to tackle such matters, and then you have a high burden on the health sector and also on the country at large, because one of the things that show the wealth of a country is their human capital. So if we say a large population of us are having diabetes mellitus, it means the people that are going to be able to do certain kind of work or perform maximally in their place of work are going to reduce. So that's another burden that we tend to see.
Okay. Okay, viewers, I still remind you of the numbers 090 7111 5342. Let me call them 09 07 111 5342. I'm waiting for your calls while we continue. Before we go on our first break, maybe I believe that for non-communicable diseases, the causes and the risk factors, it looks like they are very, very close.
Oh, they are close.
They are close. So maybe can you lead us through what we think are the causes of the risk factors?
Okay. When I was trying to define what diabetes is, I said it's a complex disease.
Yeah.
Okay. But if we are now talking about some of the things we know, the risk factors we know. Yeah. Like last week, when we talked about hypertension, we said your own body constitution, that's your genetics or familial problem. If you have a family history, that is one person, just one person in the family, if you have to go back, far back or forward, you will find more people.
So what's family? What one person? What sphere of family? Cousin, uncle?
The biggest risk factor is the parents and direct children.
Okay.
If a mother, if one of the parents is diabetic, the risk is about 40% for every child of that woman to have diabetes, or of that parent. If the two of them are, which is common, especially in some parts of Nigeria, it is common that you will find both the husband and the wife are diabetic. The risk is more than 50%. So it is, and since we also have the problem of our own type of food, majority of our food is high in carbohydrates or starch, high. You will have a whole bowl of rice or pounded yam with just few pieces of meat, which is meant for only maybe the adults. The children will have that large quantity of carbohydrates too, with a piece of meat that they have to share. So the protein content of our food is much lower. That is our own diet, which is cultural. So that also does not quite help our situation when it comes to risk factors. Another thing that is adding to the statistics that Dr. Fumi gave us is it is not limited to Nigeria or other low-income countries. It is a global problem. It's just that in the other climate that is not, that they have higher income, they are able to do things for their people. Whereas in low-income countries, the problems are too many and overwhelming, so not much is being done. So people have to look after themselves, which is what we call out of pocket. Whereas in those other places, there is adequate insurance policies that will look after such people. Where there are things that advocacy that are being done here in Nigeria too. But maybe we will leave that, we will discuss that a little bit more some other time. But if you say I should talk about it now, I mean, we have a national health insurance scheme. It is only federal staff, civil servants that are covered. Civil servants that are federal, the percentage is very small. Out of the 36 states and FCT, which makes it 37 in Nigeria, less than 10 states have had in place insurance, less than 10.
Well, it's heartwarming that up to 10.
Oh yeah,
let's look at it that way, up to 10. We are coming up.
There are states, because once you have insurance, you will not be afraid to go and check. And to manage diabetes is also not easy. We have just talked about diet. The one that is easy is exercise. I've just told you now that our food is difficult. Because virtually everything that we say our own native food is mainly carbohydrates. So that makes it difficult. But if that is all we have, you are now asking somebody to say you have to eat more beans. Beans is much is costlier than rice and corn, which is common, which everybody can grow. So those are the problems that is making this burden higher. Unfortunately, also, in the low-income countries, we are also copying the West that have better care for their citizens. We are not exercising enough. Because if you exercise enough, whatever you eat, you are likely to burn the excess off.
Yes.
But if you are eating too much carbohydrate, or that is sugar and sugary things, and you are not burning it, the excess is being stored as fat, and obesity is going to start. Your pancreas that is trying can also get overwhelmed, and we know that obesity is also another risk factor, even for diabetes.
Okay.
So
but this diet thing, our diet thing, our forefathers, they walked the farms, they trekked 10 kilometers to the farm in the forest, they walked the farms, they came back. They needed a lot of energy to do that. I think that compensated for the exercise. Now, we enter our cars, we drive to the office, we sit down, we still eat the same kind of majorly carbohydrate diet. We do not burn them again. I think it's because we seem to have migrated from our system of working very hard every day to a system of working less, but still maintaining our diet.
Yes.
Are there other risk factors?
Yes. Again, our habits.
Okay.
We've talked about food, we've talked about exercise,
so weight,
and we've talked about weight, because it is in fact, weight. What we now know is when I was defining that, there is something like that we call insulin resistance. That is to say, the quantity is not the problem. It is the fact that it cannot function where it is supposed to function. It looks as if fat cells have blocked that place. So that is the relationship between obesity and diabetes. It is commoner in people that are obese. That's the type 2 diabetes common, because they tend to have the insulin resistance, because there is no place for the insulin to act and do its work and maintain a good blood level. So that is another risk factor. Then we also know that some other things, because there is primary diabetes. At least I've just told you now, we know insulin is a problem. But there are other things that is not directly from the pancreas. Drugs, for example. People that are overweight are likely to also have joint problems. One of the treatments for chronic joint problems is to give steroids, maybe either as tablets when they have pain or into the joints. That can predispose somebody to becoming diabetic. And if you have the tendency like we defined before, you now have, but you are maybe maintaining, keeping away from becoming diabetic because of your lifestyle that you've adopted, exercise, you are minding a doctor now gives you a steroid to swallow, either for asthma or for joint problem. Then it can flare up a diabetes that was just waiting. So drugs is also a problem. There are a few other diseases, and the one that you say is not drug is contraception. We want to control the number of children you want to have. One of the ways that you gynecologists or obstetricians says let's do contraception, oral contraceptive pills. Some of them also predisposed to becoming diabetic in people, especially people that are predisposed or people that are fat. That's another factor.
So allow me to draw you back a little.
Okay.
It appears that there are times that we see diabetes in very young people.
Okay.
What type is that?
I say that's mainly type 1. Mainly.
Okay.
In fact, it used to be called juvenile
Okay.
Juvenile onset diabetes.
Okay.
Because usually if we see a person that the blood sugar is in the diabetic range and is below the age of 20, we can almost say this is likely to be type 1, which means for either infection, which is or some autoimmunity, had destroyed the special cells in the pancreas that produces this insulin.
Early enough.
Early enough. And it wipes them all out. So and another name we're calling them before is insulin-dependent diabetes, which means there is no other treatment that you can give them. Because when we come to treatment, you know there are other treatments that we can give other than insulin. There is no other treatment that you can give such people except insulin. That's why I say they are dependent. If you don't give them insulin, they develop a life-threatening complication that we call ketosis.
Yes.
So we used to call them insulin dependent. So in young people, so age is a problem.
Yeah.
And that is what research seems to have advanced a little. We are trying to see, is it possible either to give a vaccine or something that will protect the pancreas of young people from getting attacked by either viruses or even autoimmunity. That is being worked. So if we are going to have a cure, it's likely to start from the diabetes of the young people that affects mainly the young people. Yes, there are, and it is called type 1. We will hear type 2, type 1. The type 1 is usually
the one in the young
people. It's commoner in the young people.
And maybe we should continue, but I need to prompt the listeners that the number to call is 0907 111 5342. Please, like I said, we've tried to rectify our system, and we think we will be able to communicate with you. Now, Dr. Elusoji, how do we measure? How do we know that someone has diabetes?
For measuring the blood sugar levels for a person, because if we're saying someone has diabetes, it means the blood sugar is above normal, the normal blood sugar. We use a particular apparatus. It's called a glucometer. So what they do is they just give the person a prick, a needle, and then put it on that machine, and it measures the blood sugar for the patient.
Yeah, but is that adequate to make a diagnosis of diabetes mellitus?
Let's put it this way.
Yeah.
Everybody that is alive must have sugar in the blood.
To survive, yeah.
You must have, because it's the most efficient source of energy, and especially the special cells in the brain, they cannot make use of any other thing apart from sugar. So you must have sugar. That's why doctor is emphasizing that it has to be abnormally higher than what is expected. So everybody must have sugar. So we, in the past, we used to measure, diagnose diabetes using the urine, because if the level is too high for the kidney to filter, because as I said, glucose is very, very important to the body. So the body wants to keep it as much as possible in the blood. So if it is too high, you now have some spillage into the urine. So if you check the urine of a diabetic patient, it's likely to also have sugar, which should not be there. But these days, because we know that even malaria, pregnancy can cause sugar to be in the urine. That's why it's no longer reliable. So what we now rely on is measuring the blood glucose, using a glucose meter, glucometer.
Yes.
And there is a figure that is now accepted. If a fasting blood sugar is higher than 7 millimoles per liter, or 126 milligrams per DL, that person is diabetic. There's no argument.
Now this is a little bit confusing. If we have to say 7 or 150, what is the relationship between that 7 millimole or 150 milligram? Because people now buy their testing materials, and some give them results in millimole, some it's, what is the relationship?
The relationship is a factor of 18. These are measurement units. There is one that measures in millimoles per liter. there's another unit that measures in milligrams per dl.
Okay.
So if your machine, if it says 7 millimoles per liter, if you multiply it by 18, you will get 126 milligrams per dl.
Okay.
But if your machine measures maybe 130 milligrams per dl, you can divide it by 18 and you'll get the equivalent.
Okay, because many people are getting to buy their glucometer, which I think is a good. We will get to talk about that, but I think it's a good thing.
It's a good thing
for.
So that is one criteria for making a diagnosis.
Okay.
What of if it is 6 point?
Hello, good evening. Welcome to Africa Health TV on DSTV. This is Clear on Health. Who is speaking and what do you want to contribute? Okay.
I'm speaking from Ida in Kogi State. I'm Sovio Sule.
Yes, Sovio Sule.
Yes, good evening.
Good evening, sir.
I'm enjoying the program because I am diabetic too.
Okay.
So I'm not lying down, but I'm taking my medication and have my own testing kits which I carry out. But now I'm having kind of, my leg is sort of heavy.
Okay.
The leg is heavy and a little bit sore on my it will come and go on my foot.
Okay.
So I'm trying to get over it. Suddenly it will come, bring out there and go back.
Okay.
But my leg again, it looks as if I'm having shock inside the leg.
Okay.
That's the problem I'm having for now.
Okay, thank you very much. I believe the guests here will handle this.
It's okay.
Thank you, sir.
I will follow your program. Please let the doctor speak about it, please.
Okay, sir. Thank you very much.
It's a pleasure.
Yes, sir.
Right. Thank you. I hope you can hear me. Thank you very much for the question. Yes, it is related.
Do I need to on my TV to listen to you through the phone?
Right. It is.
No,
can you
can
hear
drop.
me?
You can drop and listen to us through your television. Okay.
Okay. Right. It is a common, or is one of the things that can happen to diabetics.
Yes, he said his leg is heavy.
Yes.
His leg is
In fact, we have a beautiful.
is weak, and the pus comes out, and there is a sore.
Okay.
Maybe beginning from him, what are the things that we expect when this sugar rises? Beginning from Sovio Sule's question, beginning from his own kind of symptom.
The question.
And why do they occur?
Okay. His own is a complication of diabetes that he is showing already.
Yeah.
It means his nerves, his peripheral nerves, are being affected.
Yeah.
And every part of the body is connected to the brain via the nerves.
Yes.
It is the nerves that will tell us you are stepping on something sharp.
Yes.
You are stepping, your leg is near something hot,
Yes.
or this is very, very cold.
Okay.
Even without seeing it, the nerves will take information to the brain.
Okay.
If the nerve is affected,
Yes.
it sends wrong information to the brain.
Yes.
Sometimes it will tell you that they are using pin to choke you. Something is pricking you with a pin, whereas there is nothing.
Okay.
Or you are stepping on the floor and you are see there is a layer of Vaseline between your feet and the floor, or your legs feels heavy as if it is not your own, or
Yes.
as if there is no blood there.
Yes.
These are signs of complications of diabetes.
Okay.
And this type of complication actually comes with the duration of the disease.
Okay.
So even people that are well controlled are not exempted from this type of complications of the nerve. We call it neuropathy. Whereas there are other complications.
Yes, sir. I think this is very important.
Right.
Because I would like you to tell Engineer Sule what point of complication he's in. But I think that we should take a break here so that when we return, we start with that.
Okay.
Engineer Sule will listen to us, and whoever has this kind of issues should listen to us. Again, prepare the number 0907 111 5342. Until we return, please stay tuned. Welcome to Clear on Health.
TSTV, connecting your world.
Well, welcome back. This is Clear on Health, showing on Africa Health Television on TSTV. I'm glad you are tuned in to us. If you have just tuned in, we are discussing non-communicable diseases, particularly diabetes mellitus. We've said the burden of the disease and characterized what the disease is. We had a caller who has some part of what we call complications, that he is no longer feeling well, and sometimes his leg is heavy, and sometimes pus appears and disappears. Some sore is appearing in his leg. You were trying to explain to us what has happened to him.
So the one that, as I said, that he has abnormal sensation in the feet is because the nerves are being affected by diabetes. So the nerves is giving wrong information to the brain. Now the danger of that is likely, engineer might injure himself, stepped on a nail or a thorn without knowing. Because if anybody steps on something sharp, the nerves will tell the brain that your right leg, your right foot, or your left foot is standing on a nail, and the brain will send information that remove the foot from there. But if the information is not there, then it is likely that you even stand on it, even for long. The nail or the thorn enters, or the pin enters, and you walk away without knowing. If you don't know that you have injured yourself, you won't clean it, you won't treat it. Infection now enters through that injury. And since there is no pain, the infection will be spreading. If the infection spread to the extent that maybe it is somebody now say the thing is smelling, what is smelling? And then you notice. By the time you notice, it might be too late.
So if I get you well,
yes,
the complications has affected the nerve.
The nerves. And
complication has caused infection.
Infection can lead to infection.
Can lead to infection.
And if infection is not properly treated, by the time it gets to the hospital, we will say we have to amputate.
Oh.
So that is the beginning, beginning of amputation. And that's why we said when anybody that has had diabetes for more than 7 years, from my experience, we must talk to that person, educate that person, on how to look after the foot.
Oh,
So we call it
I
foot
think
care.
we must digress to listen about food care before we continue about the other complications that are possible.
So we talk about foot care education, and the idea is you can enjoy your feet now because you can no longer depend on your nerves. So you now have to use your eye to inspect the foot. So every day, yeah, we advise that every person that has diabetes and that has gone on for more than 7 years,
yeah,
whether you have the complaint or not, you should look at your feet, especially under the feet. Mm-hmm. What are you looking for? Is there any injury? Is there any change in color? Is there any swelling? Mm-hmm. If there is, please don't wait. Go to your healthcare center and report it.
Okay.
If they say don't worry, that's a different thing. This, and if you can't see it, you can use a mirror to look at your foot. Or you can get somebody in the house just to inspect your foot for you. And as I said, you are looking for something that shouldn't be there. Is there anything? And then you do something about it.
Okay.
We also say if you are buying shoes, especially covered shoes, try and buy the one that is maybe one size bigger than your leg. Because if it is too tight and you walk with it, ordinarily if the nerves are working, you will have pain. And maybe as soon as you sit down and you have opportunity, you remove your shoes.
Okay.
It is when you are going that you put it on. But that is if you have pain.
Okay.
But because that pain sensation is faulty,
okay,
you keep the shoe as if there is nothing happening and maybe it's a beautiful shoe. But it is on the fifth day you now notice that you have some sore area because of the pressure. So we advise that please buy a shoe that is not too tight.
Okay.
Even if you wear socks, don't buy the one that is too tight.
Okay.
So those are the things, what we call it. And then some women, when they prepare tuwo,
yes,
or any of these swallows, they use their leg to hold the pot.
Yes.
And we also say, please pad your feet, because women can endure so much heat.
Yeah.
But until you burn yourself, because the nerves is not working well, you may not know. So we say avoid that.
Oh, this must be very terrible for someone who probably does not even know that she has diabetes.
Yes. And so that's why we say anyone that if you have such a complaint, please see your doctor.
Okay. And
anyone that has diabetes, whether the complaint is there or not, if you've had diabetes for about 7 years and more, please check. Do foot care. And then we discourage you from walking outside barefooted.
Okay.
Because you are more likely to injure yourself without knowing.
Okay.
And then we say even bathroom slippers. Pain can pierce through soft bathroom slippers. So wear shoes that are strong.
Oh, yeah. so many instructions.
Yeah, so those are that's what we call.
Somebody, I hope the person who called is getting these instructions.
He also now said pause is coming.
Yes.
Another complication that is common with people that have diabetes, especially when the control is not good enough, is that they have increased tendency to infection, skin infection.
Yes.
So one boil is finishing this time. In 3 days, another one is starting somewhere else.
Okay.
Because there is poor blood flow, because the nerves, the blood vessels are getting narrowed because of diabetes.
Okay.
So they are more prone to infection. So infection of the skin, an infection of the urinary tract, and especially even in the buttocks where you sit, where you are constantly sitting down. So that's why once you have diabetes, no matter how well controlled your machine is telling you, still see your doctor once on a regular basis. And this is what the doctor should check.
Okay.
Is there any infection? Is there any chest infection? They will ask you, is there any chest infection? Is there any pain when you pass urine to see whether there's urinary tract infection, or do you have boils?
Well, I think we have a lot to talk. I don't know whether we'll be able to finish today, but I think we should prepare to finish so that tomorrow we can take another non-communicable disease.
So we might as well talk about the other complications.
Yes.
We just had one.
I would like us to take a break. When we come back, we will do the other complications. Viewers, remember the number, and please prepare your questions. We are ready to answer you. We want it to be very interactive. We will go on break now. When we come back, we continue with the other complications because we need to talk about them and then tell people what to do. welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back. If you've been listening, we've been discussing diabetes mellitus. We've discussed several things about it, particularly now the complications. We have discussed the complication of a diabetic foot, of involvement of the nerves, which doctor was calling neuropathy. Don't mind the big word. We have discussed infection, the easy way people can get infected. Dr. Lusoji will tell us a bit about the diet, but I would like Dr. Ajuon to still complete the issues about complications in different parts of the body.
Right. Because the excess sugar is flowing in the blood vessels, they tend to affect the blood vessels.
Okay.
And the affectation of blood vessels will eventually lead to narrowing of the blood vessels.
Okay.
That means poor blood supply. So you have an infection somewhere, ordinarily your immune system will send blood cells that are soldiers.
Yeah.
But that is, if the blood flow is now not efficient, it means soldiers do not get there on time.
Yeah.
So infection tends to fester.
So is this because of the fluidity or less fluidity of the blood? Is it because of the thickness of the blood that the immunity doesn't work, or because of the high level of the sugar?
The high level of the sugar is the one that affects the blood vessels.
Okay.
The blood vessels then get narrowed and affects the flow.
Okay.
Yeah, affects the flow. So it means every blood cell can be affected in a patient that has diabetes, especially when the control is not good. Because as I said, everybody must have sugar in the blood every time that you are alive. But when the level is too high, it then tends to settle on the sides of the blood vessels and narrows it.
Okay.
Now, but some places are more prone.
Yeah.
Just similar to what we discovered when we were talking about hypertension.
Yeah.
The blood vessels that supply the brain, they are prone.
Okay.
So a stroke is commoner in people with diabetes than in people that do not have diabetes.
Okay.
Eye problem
Eyes.
is also, the affectation of the eyes is also commoner in people that have diabetes than people that do not have diabetes.
Okay.
That's from outside, from cataracts to cornea problem to high blood pressure inside the eye to bleeding inside. So it can lead to blindness as a complication in diabetes.
Boom.
It can also affect, it can cause even heart disease also. Since we are saying it is blood vessels, the heart itself has blood vessels. Then it can cause kidney problem. So people that are on dialysis or that require transplant, majority of them are diabetic and probably also hypertensive.
Okay.
So these are the complications for people that are not well controlled.
Okay.
But if they are well controlled, you can prevent these complications.
We talk about the preventions, and I'll allow you to talk about more of the prevention, but I would like her to quickly enlighten us about the diet.
Yeah, so like we said earlier,
That's a part of the beginning of complications and prevention.
One of our issues in a country like Nigeria is carbohydrate food.
Yeah.
It is the major food that we eat. We don't go out and not have a rice or an eba or some. So these are, and we hear that we are talking of high blood sugar. Eventually, starch is broken down to glucose, and then this glucose has to be worked on by insulin and then stored up in the body. So one of the issues we have in diabetes is increased eating starch foods or glucose foods. So for diabetics, they have to start substituting that diet for foods that are high in protein, you know, reduce starch, or even try and stop it completely if you can. Eat more foods in protein. Most of the foods that have protein, like beans, still has some percentage of, you know, starch, so it can balance up. Or, you know, take healthier alternatives. I think the other time we were talking about wheat. Now, wheat can be a healthier alternative. So reduce those kind of foods that would, you know, predispose them to having high blood sugar, that they don't have enough insulin to work on. And then vegetables, more vegetables, fiber, you know, it will help to bring down the blood sugar. And then for those people that eat, because we say, okay, don't eat refined food, you say, okay, eat fruits. Now, fruit has sugar, watermelon has sugar, orange has sugar, pineapple has sugar. So
that's the idea, because the body needs sugar.
Yeah, so if you're going to be eating something like that, you have to not eat it like someone, like when you did not have diabetes. Okay. And then another predisposing factor, risk factors for having diabetes, is the fact that you are getting older. Dr. Adjuan was talking about the cells that help with breaking down sugar. You don't know the level they are working at 40 or at 50 years old, and then depend also on your predisposition, other, you know, genetic factors that are involved. So once you start getting older, it is sensible to reduce certain kind of food or certain kind of diet you would like to eat normally. You can't eat starch like you eat when you were 15 or 16. You can't, you know, snack on sweets and other things like you would snack on when you were younger.
Yeah, but talking about snacking, maybe something we must mention about Nigeria. In some parts of the country, the snack probably is worse than the main meal. People snack on maybe fura and then put 5 cubes of sugar, 10 cubes of sugar, and then some alewa is passing, mazarquela is passing, zobo is passing. So many things. Every single snack or pastime is sugar. I think that probably may be worse than the major carbohydrate diet, because in sitting in one place, somebody will take sugar cane, will take the products of sugar cane like alewa or mazarquela, will take simi, will take zobo with sugar, we take kununzaki with sugar, we take everything. Those snacks, I think they are really. Do you want to mention something about it before you conclude with the prevention? I mean, yeah, preventive measures.
Yes, it is just, you know, I think that's one of another hard area when we are managing diabetes. Is diet, because if you go to the dietitian, they give the instructions that is difficult to keep. So whatever instruction we give to patients with diabetes diagnosed, we have to walk into it what is possible. What is practicable, what is human, what is humane. Because if you say, don't eat this one, don't eat that one, what is there to eat? So that's why
very important
that's why many patients avoid the hospital, or they just say, look, somebody must die of something. Because we do not give practicable and practical instructions. So the diet of a diabetic who is already diagnosed, the only thing we say don't take is the refined sugars. Sugar, whether it is cube, granulated, or
inside soda,
or liquid, which is what is in soda, Coke, Fanta. Those are the things we say don't take
at all.
All right. The other things we also say don't take is honey. Whether it is pure honey, whether it is not pure honey, because you hear that, oh, honey is good for diabetics if it is pure. It becomes sugar in minutes, becomes glucose in minutes. So we say avoid it. It is also good to avoid sugar cane. They're in the same class. But fruits, yes, the ones that are fleshy, like banana, like watermelon, like pineapple, like orange, like grape, don't take plenty, but you can take them. But things like cucumber, like carrot, like cabbage, like watermelon, like garden egg, you can finish a whole basket.
But let's talk about plenty for those class of drugs, fruits. What's plenty in orange? Since orange we can measure in numbers.
Yes, if you are taking orange and you take more than 2, it's getting too much. And if you want to say orange juice, you need like 6 for 1 cup. So we are saying don't take orange juice. Take orange, eat everything that will help us. So don't take more than 2. If it is banana, don't take more than 2.
Okay.
If it is pineapple, please don't finish it alone.
Okay.
Even if it is watermelon, mind the quantity.
Okay.
If it is apple, don't take more than 2 at a sitting.
And probably not
can,
frequently.
You can do it after you've eaten your meal, maybe 1 hour or so or 2 hours after you can take, but don't at a sitting. Don't take too much, because eventually they become sugar, and we are saying your system can't handle it. So
Okay.
we don't want to give an advice that is not practicable, because there is no cure for diabetes mellitus yet anywhere. So all the news we hear about this one, take it 3 months, you'll be cured. They are lies. I can say that one, because it is not as if we are not looking at possibilities of local things that will help diabetics. But there is none that is effective, and there is no cure for diabetes yet. If there is no cure, then we shouldn't make life unbearable. We must give advice that is practicable.
Okay.
Right. So that is as far as diet is concerned. And I agree entirely when she said there are some carbohydrates like grains that are safer.
Yes.
The reason is, if I am going to have rice, the processing of rice, you remove everything, you also parboil it before you now cook.
Yes. Sorry, sir. I must stop you at this stage because it's becoming more interesting. But we can't finish diabetes. I know even in the classroom, you can't finish just in a lecture or 2. But we are hoping, viewers, that you have grasped something concerning diabetes. We wish we can continue over and over. But we don't mind. If your questions, even in the subsequent days on diabetes, we quickly answer and continue what we want to do. Tomorrow, we will talk about another non-communicable group of diseases. Those diseases that has to do with respiration, that have to do with your lungs, that are not from infection. And because in the next 3-4 days, we have World Cancer Day, we will begin to talk about cancer maybe on Thursday. We'll lay a foundation about cancer generally. So you must stay tuned so that you can understand these things, and you must call in so as to enrich our discussion to know what else you most. I'm grateful to my guests, Dr. Olusegun Ajuwon.
Thank you.
Welcome, sir.
Thank you.
Thank you for being available.
Thank you very much.
Thank you, sir. And Dr. Elusuji, thank you for being available.
Thank you, sir.
So tomorrow, we will have a respirologist who will join us to talk about non-communicable diseases that have to do with the lungs, with the respiratory system. You must tune in at 6 p.m. tomorrow on this program, Clear on Health, on Africa Television, which is showing on TSTV. Thank you for listening in, and good evening. And welcome to Clear on Health.